have gone to the community, and the community have scored the facility in accordance to the 9 indicators in the Community Scorecard.
Community to score our hospital in terms of our service delivery. It is an initiative that is citizen-driven to hold public officers accountable for the resources and the delivery of services.
A civic tool which allows communities to bring their voice to health service delivery.
The County Government of Nyeri is dedicated to continuously improving the quality of health services offered to its people. It has since partnered with key stakeholders to improve the health care services. In partnership with African Leaders Malaria Alliance, ALMA, the County Government of Nyeri rolled out a Community Scorecard. This citizen-driven accountability tool enhances civic involvement in delivering quality health services. Mobilization of community resources, providing quality health services, and building trust between community and the service providers are the main objectives of this Community Scorecard. Robert Decker of ALMA highlighted the importance of this powerful tool, adding that the Alliance is conscious of the importance of feedback in health service delivery, hence why it has facilitated the process.
My name is Robert Ndieka, and I work for African Leaders Malaria Alliance. And we have been supporting the Community Scorecard, which basically is a civic tool which allows communities to bring their voice to health service delivery. And this is a very powerful tool, and in Kenya we've been supporting the national government as well as the county governments to roll out the tool. We have done this so far in around 10 counties, and Nyeri is among the 10 counties that we supported. And we are doing this because we believe that health service delivery can only improve if we can listen to the clients, the people that we are serving, and we listen to their issues and what is it that they want us to do to improve the quality of services that we are offering. Also, by doing that, we make them to be owners of the same services that we deliver, and they own both the facilities as well as the people that are giving them the services. And together, they start looking for solutions to improve service delivery.
Nyeri County Community Health Coordinator Anduta noted Phase 2 focused on high-volume health facilities, including the County Referral Hospital, formerly known as PGH, Mukurweini, Karatina, Mount Kenya, and Othaya Level 4 hospitals. She further noted that the tool will assist in highlighting areas that require improvement in the facilities through community members providing their views on 9 key areas. Respectful and compassionate care, waiting time for the provision of healthcare services, availability of medicines and diagnostic services, responsiveness to the community health needs, cleanliness of the facility, home visits by the community health volunteers, assessment of NHIF services, emergency and referral services.
This week we have been doing the Community Scorecard Phase 2. Phase 1 we did it in February earlier, which we were scoring our, in Phase 1 we were scoring our level 1 and level 2 and level 3 facilities. For this Phase 2 we are scoring the high volume facilities. Those are level 4 and level 5. That is Karatina Sub-County Hospital, Mukurweini Sub-County Hospital, Othaya Sub-County Hospital, Mount Kenya Sub-County Hospital, and our referral hospital, which is PGH, County Referral Hospital. The reason why we decided to score in Phase 2 is it was due to public demands. We wanted to engage our community and to know why do they complain and what do they want to be done the right way at those levels of care. And we have discovered that it was a good engagement, and we hope that our communities are going to benefit, and also the facility is going to benefit at large, getting the feedback from the community, what they are not doing right and where they would want them to change.
According to Health CC, Dr. Joseph Kerago, the community-driven approach will help influence the quality of health services in Level 4 and Level 5 health facilities. The feedback gathered during this week-long exercise from community members will assist the Department of Health Services in improving on areas highlighted.
A 1-week-long exercise called the Community Scorecard, a community-driven approach to influence in improving the services of our healthcare. It takes into account about 9 parameters, including cleanliness, including customer care, including security, and actual treatment, and the contribution of the community health volunteers, and such parameters which would make them as our customers happier and more satisfied with our services. They have already given us a feedback, and from this feedback we expect that our health services will improve as we implement the issues of concern that were raised by the community. This includes customer care and proper supply of timely supply of drugs, and much more community involvement. It is a tool that tells us how the hospitals are seen by the community, and then they have their own contribution in bettering and improving the institutions around them.
Health Services Director Dr. Nelson Moreu also noted that engaging community members on health matters is paramount. Hence, the tool is timely intervention, as it will help address areas that require improvement by health facilities.
Nyeri, and I want just to make some brief remarks in regards to Community Scorecard, which is a partnership that we've been having with one of our partners, that is ALMA. And I want to first of all just say what is my experience, both as a leader and as an institution of the Department of Health Services. That one, we feel that moving forward, this is the way to go, because there's need for engagement of the community in our healthcare services. We need to have the bigger community, such that when we invite for this community scorecard, you bring in the community leaders, you invite who is who in the community. It not necessarily does not have someone who holds a post somewhere in the community. Because at times you've noted, as a service provider and also as someone who is coming to seek care, there are certain feedback that I'm sure there are a lot of people out there who've always wished they had an opportunity to come and say, either you're giving a compliment or you're making a complaint.
Nyeri County Referral Hospital Medical Superintendent Dr. Pauline Kamau appreciated the process, which will start a timely conversation about the quality of care being provided in the health facilities. She emphasized on how critical the feedback from the community members was about various indicators, noting that the health facilities will make significant changes on the weak areas highlighted by the members of the community.
We have had an engagement through the partnership with ALMA for the Community Scorecard for hospitals. That is an opportunity for the community to score our hospital in terms of our service delivery. It is an initiative that is citizen-driven to hold public officers accountable for the resources and the delivery of services. We sincerely appreciate the scorecard and the results that we have received as a facility. We continue to appreciate the feedback that we've received from the community with regards to the different indicators that were on the scorecard, and most importantly, just to give us an opportunity to even engage with the community as we air out some of the challenges that we face as a facility with regards to offering services to the community, and also receiving that feedback from them.
Magdalene Derito, Nyeri Central Community Health Coordinator, noted that the process was successful and was happy with how the health facility in charge teams received feedback from community aggressively and took upon the responsibility to address the areas highlighted by the community members.
We are happy because the facility, when they got the feedback from the community, they are able to take the the views of the community in a positive manner. And as per now, they have given the community the feedback of the questions that we're asking. So as the coordinator of the community health services, I am glad because there are so many questions that we are asked at the community level that we were not able to answer them. But now with the linkage of the community to the facility and the way our facility management has gone back to the community to give them the feedback, they are able to give the answers that we could not be able to answer.
On the other hand, Francis Kimani, a resident of Nyeri Town, expressed his gratitude for being involved in this process, emphasizing that it is a need for public members to provide feedback on the areas of improvement on their health facilities as they are the consumers of these services.
Hii process imeniridhisha sana kwa sababu kuja hapa kwa ground kuuliza mambo kama haya hatujaiona tena katika kaunti yetu ya Nyeri, na kuja hapa kuulizwa kwa sababu sisi ndio ambao tunahudumua pale katika we are the customers in that hospital, or we are the people that attend that hospital. So we are happy that you have given and we have aired our views. Yes.
Nyeri County government leadership is very appreciative of ALMA for its facilitation of this process, which will help improve services of the health sector, a pivotal docket to the current administration that envisions a healthy county with happy, healthy, and secure people.
The county is really dedicated and focused on continuous service improvement to our people.